Hello, welcome to any community. In this particular video, we are going to discuss about the Pranavaha Srotodushti and its applied aspect. As we have discussed regarding the Srotas is the one wherein the Sravana is happening. The term Sravana refers to some kind of the movement, maybe oozing, or maybe permeability of that, or maybe the transport of any one particular substance from one place of the body to the another place. So in this particular video, we are going to discuss about the Pranavaha Srotas as such. Ayurveda says, Pranavahanam Srotasam Hrudayam Moolam Mahasrotascha. So that means the Pranava Srotas is having the Sroto Moola. So that means the ends of these particular Srotas. On one end it will be Mahasrot and on the other end it is Hridaya. So that means the person will be having the affliction of a Pranava Srotas Vikara if there is the involvement of either Mahasrotas or otherwise Hridaya. So when you think about there are three possibilities. There are pathogens, let us assume that is the pathogen 1, P1, P2 and P3 may be the source of entry of the pathogens into the body. Whereas the 1, 2, 3, 4 and 5, that is here oral cavity and hridaya are specifically explained. These are the two sroto ends of the organs of this particular pranavaha srotas, and the movement is happening from mahasrotas to hridaya in that particular situation. So the clinical manifestation, if the pathogen is entering through the nose, then the initial lakshana that can be observed in the patient will be sneezing, nasal blockage, or the inability to perceive the smell, etc. Suppose if the entry of pathogen is happening in the oral cavity, for example, pathogen 3, that is the in that particular oral cavity, then the clinical symptoms will be observed in the oral cavity, but the nose as such that will not be showing any kind of the affliction as far as the clinical manifestations are concerned. Whereas P2, if you consider that is the entry of pathogen is happening in the hridaya, initial manifestation will be seen in the hridaya only. Whereas the 4, 3, 2 organs that may not be afflicted at the beginning. Whereas if the pathogens are entering through the either nose or mouth, that is either in the pathogen entry through the nose, that is P1, and P3, that is through the oral cavity, then initial symptoms that can be observed in the oral cavity, then organ 2 may be afflicted, then organ 3 may be afflicted, and organ 4 may be afflicted, and organ 5 may be afflicted. Whereas pathogen 2 entry, if that is happening, then organ 5 may be afflicted, whereas organ 4 and organ 3, etc., that may affliction of those organs may be little bit less likely. The reason is the movement of the the movement is happening from Mahasrotas to Hridaya Pradesha. This is the reason where the Srotomula, as such, the concept of Srotomula plays a major role there. As far as As far as Nidana of Pranava Srotodushti are concerned, it is mentioned in Charaka Samhita that Kshayat Sandharana Draukshat Vyayamat Kshuditasya cha Pranavahini Dushyanti Srotamsi Anyesha Darune. So it is being mentioned that Kshayat Sandharana Raukshyat Kshuditasya Vyayamat Anyesha Darunaihi Karma. So when you look into the word meaning of each of these, Dhatukshaya, the body is dividing of nutrients, maybe macronutrients or micronutrients. Sandharana, that is suppression of the urges, naturally occurring urges. So that is either it may be cough or sneeze or tears or the appetite or the defecation, maturation, etc. Raukshyat, that is excessive exposure to the ruksha substances. So that is consumption of the poha, etc. Shuddhitasya vyayama. So that is the doing the vyayama in case of hunger. It is not the empty stomach, hunger. And dharuna karma, that is activities which are leading to depletion of the nutrients. Now we are going to look into these in a little bit elaborate manner. Further, Dhatu Kshaya refers to, what actually Dhatu Kshaya refers to? The term Dhatu, that is the body tissues as such, Kshaya refers to depletion. It may be either one Dhatu Kshaya or all the Dhatu Kshaya may also be possible. Two Dhatu Kshaya may be there, 3, 4 or 5, 6 or all the 7 Dhatu Kshaya that may lead to Pranavaha Srotodushti. How that is possible? Whenever there is the Dhatu Kshaya, in the sense there may be a possibility of the depletion of either macronutrients or micronutrients. When this is macronutrients are going to get depleted naturally, so that will be initially associated with carbohydrate depletion, which is later resulting in the fat depletion. Later the person may have protein depletion, whereas the person who is having the fat depletion, that will be leading to the ketosis, ketoacidosis. At the same time, during the muscular metabolism, the person may have the lactic acidosis. So that means this is what is considered to be the metabolic acidosis as such. During the course of this particular pathological event, the person may develop respiratory alkalosis, will be the next stage, which is mainly having the clinical symptoms such as hyperventilation, which in turn results in electrolyte imbalance. Along with that, there may be a possibility of Udakakshaya or Rasakshaya, which is again leading to the dryness of mouth, wherein the person will be taking the breath through open mouth, wherein there may be a possibility of entry of the droplets or the dust, smoke, etc. that will be happening through the oral cavity, open mouth. There may be a possibility of the entry of these into the respiratory passages, or Pranavaha Srotas as such. Thereby the person may develop Pranavaha Srotodushti Lakshana. As far as Sandharana, the term Sandharana refers to Vega Sandharana, that means suppression of the urges as such. Here we are going to look into some of the urges, if suppressed, in what way, so that will be leading to respiratory symptoms. For example, cough suppression. So that means if the person is suppressing this particular cough as such, so this is actually responsible for the non-expulsion of sputum or pathogens from the respiratory passages to the exterior will not happen. Or otherwise, if the person is swallowing the sputum, then there may be a possibility of entry of these dead bacteria or otherwise the microorganisms or weak microorganisms into the alimentary canal. Thereby that will be leading to that is Abhyantara marga affliction, which in turn results in the absorption disturbances, thereby metabolic acidosis and respiratory alkalosis, like that may happen. So, in case of the fluid flatus or fecus suppression, what actually happens is there may be a possibility of absorption 98% of the gases that may take place from the large intestine. And this particular absorbed gases that will be expelled through expired air. That is the reason the persons who are having the fecal suppression, they will be having the halitosis or bad breath through the expired air as such. Further, vomitus suppression. So if the person is suppressing the vomiting, then there may be a possibility of entry of these vomitus into the respiratory passages. Thereby the person may have the respiratory symptoms or Pranavaha Srotas symptoms can be observed. And if the person is having this pathogens are present in the alimentary canal, if the vomitus is being suppressed, this will be leading to alimentary canal inflammation. Thereby, the macromolecules which are present in the alimentary canal that may enter into the intravascular compartment as such. So that is the resulting in the absorption disturbances. Thereby, the person may have what you say that, as we have discussed earlier, that is the fat metabolism starts to occur, metabolic acidosis, later respiratory alkalosis. In this way, the sandharana may have an impact on Pranavaha Srotas dysfunction or respiratory dysfunction. Raukshya. The term Raukshya refers to the dryness. This may get increased if the person is frequently consuming the Shita and Rukshaguna substances together or in the increased frequency. So this is what we can say. This is an image of an orange wherein it is not a fresh. So in that particular sense, that will be having the less amount of the water portion. That means the inadequate amount of water will not be taken into the body. So this is leading to increase of rukshata in the body. So that means there will be reduced secretions that may happen in the alimentary canal or otherwise in the respiratory passages as such. Now the question arises, rukshata in cases of the what you say that the mouth breathing as such. So that will be resulting in the Pranavaha Srotas dysfunction. So whenever the person is having the nasal obstruction, there will be the person will be taking the breath through the open mouth, which is resulting in the compromise in the functions of nose. That is three functions of the nose. That is warming of the air, humidification of the air, and filtration of the air. So that means this will be leading to the increase of rukshata to get happen in the Pranavaha Srotas itself. Thereby the person may develop the Pranavaha Srotas dysfunction. Kshuditasya vyayama. So that means when a person is having the hunger, naturally, so that will be showing that carbohydrate is necessary to the body. At that particular time period, if the person is not doing any kind of the consumption of the food as such, so this will be leading to fat metabolism and thereby protein metabolism and water and electrolyte depletion that may happen. So this will be leading to metabolic acidosis and later that will be leading to respiratory alkalosis. In this way, Shuddhitasya Vyayama may have an impact on Pranavaha Srotas dysfunction. Dharuna Karma. The term Dharuna Karma, that is the debilitating activities more than one's capacity. So that is the obese individual, if he is walking for more than 5 kilometers, for example, or pulling the heavier objects, or doing the excessive workouts in the gym, etc. So that will be having an impact on fat depletion and metabolic acidosis and respiratory alkalosis. Thereby we can able to see the hyperventilation syndrome, etc. These are the different nidana or the causative factors for the affliction of what you say that the Pranavaha Srotas dysfunction. Now, how to identify the Pranavaha Srotodushti? It is even mentioned that Pradushtanam tu khalvesham idam vishesha vijnanam bhavati tadyatha atisrishtam atibaddham alpalpam abhishnam va sashabdashulam uchvasantam drishtva pranavahanyasya srotamsi pradushtaniti vidyat. प्रदुष्टानां तु खलु येषाम् इदं विशेषविद्यानं भवति तत् यथा अतिसृष्टम् अतिबद्धम् कुपितम् अल्पाल्पम् अभीक्ष्णं वा सशब्दशूलम् उच्छ्वसन्तं दृष्ट्वा प्राणवहान्यस्य स्रोतांसि प्रदुष्टानि इति विद्या. So here atisrishtam refers to the increased respiratory rate. More than one, that is normal respiratory rate is 16 to 20 per minute. If it is increased, then that is an indication that the person is having Pranavaha Srotas dysfunction. Atibaddham, that means the total absence of respiration. That is another indication that the person is having the That is what you say that the Pranavaha Srotas dysfunction. So here one particular word is missed, that is kupitam. The term kupitam refers to the abnormal uh, dosha presence. For example, if the person is having vata dosha dominance, then the person may have dry cough. If the person is having pitta dosha dominance, there may be a possibility of yellowish or green, yellowish colored sputum, or greenish colored sputum, or reddish colored sputum. Or if there is kapha dosha dominance, the person will be having the whitish colored sputum, etc. So that is kupitam refers to the dosha dominance observed in the Pranavaha Srotas itself. Alpa alpam refers to shallow breathing. Specifically, this will be observed when there is the pleural involvement. So, on the either side, the person will be developing the pain as such if the person is having the continuous cough as such. So, that is shallow breathing may be present. Abhikshnam, continuous breathlessness. For example, status asthmaticus, etc. The person will be having the what do you say that the Pranavaha Srotas dysfunction can be predicted. Sashabda Shulam, Sashabdam, that means presence of absence of breath sound, presence of abnormal sound. For example, wheeze, which is indicative of the either bronchial asthma, if it is polyphonic wheezing. If it is monophonic wheezing, there may be a possibility of bronchogenic carcinoma. And crepitation on the either sides. Crepitations, a coarse crepitation may suggest pneumonia, whereas the fine crepitations on the either sides of the lungs, that is base of the lungs, may indicate pulmonary edema, etc. So in all these cases, the person will be having the, what do you say that, the sashabda shwasa, or otherwise the person who is having the excessive secretions in the throat as such, gurguraka, that is one of the another, the sashabda shwasa, sashula shwasa, that means it is the painful breathing. Definitely this will be observed in cases of a pleural involvement. Uchwasa, that means expiratory difficulty. The term expiratory difficulty refers to the disturbances observed in the lower respiratory passages, maybe in the trachea, bronchi, bronchioles, alveoli, pleural involvement, etc. So, this is what we can say the affliction of Pranavaha Srotas can be predicted by observing these lakshanas. Now, how to identify the injury to the Pranavaha Srotas as such? That is mentioned in Sushruta Samhita. Tatra viddhasya akroshana, vinamana, mohana, brahmana, vepanani, maranam va bhavati. So that is the viddhasya, when there is injuries happening to the Pranavaha Srotas, akroshana, vinamana, mohana, pramana, vepanani, maranam va bhavati. So that is, these are the lakshana that can be observed. Akroshana, that is referring to the specific sound produced by the patient during the extreme discomfort. So that is whenever the person who is having the fever, etc., some of the occasions the person will be having the sound like hmm, hmm. So this is what we can say akroshana. Vinamana refers to the forward bending. Whenever the person is having the excessive strenuous work, for example, running, etc., we are going to observe to have the deep breathing. The patients or the people are bending forwards. This is what we can say vinamana. Mohana refers to confused state. Confused state in case of electrolyte imbalances or in case of glucose deficiencies, etc. Mohana, there may be that. Giddiness, reduced blood supply to the brain. The person will be having giddiness as such. Vepanam, that is involuntary movement is happening. This can be attributable to electrolyte imbalance as such. Maranam, so if it is too extreme, the person may have death of the individual also. So, take-home messages from today's discussion are Pranavaha Srotas is one of the important Srotas wherein the most of the life related nutrients, maybe the oxygen, etc., maybe the food substances, they will be entering through the body. So it is having uh, the Mahasrotas and Hridaya as the Sroto Mula. That is Pranavahanam Srotasam Hridayam Mulam Mahasrotascha. So that means the entry of the pathogens in this particular location may start either in the nose or in the mouth. At the other extreme, the entry of pathogen may happen into the Hridaya Pradesha. Pranavaha Srotodushti the can happen because of Kshaya Sandharanad Raukshat Vyayamat Kshiditasya cha Pranavahini Dushyanti Srotam Sinnesha Darune. So that is the Dhatu Kshaya, Vega Sandharana, then Kshiditasya Vyayama and Dharuna Karma are responsible for the Pranavaha Srotodushti as such. How to identify the Pranavaha Srotodushti are प्रदुष्टानां खल्वेषाम् इदं विशेष ज्ञानं भवति तद्यथा अतिसृष्टम् अतिबद्धं कुपितमल्पाल्पम् अभीष्णं वा सशब्दशूलमुच्छ्वसन्तं दृष्ट्वा प्राणवाहन्यस्य स्रोतांसि प्रदुष्टानि इति विद्यात्. So the person will be having the disturbances in terms of breathing, maybe increased or maybe decreased or maybe associated with other cough, chest pain, etc., other symptoms as such. Regarding the Pranavaha Srotas with the Lakshana, if any injury is happening, tatra viddhasya akroshana, vinamana, mohana, भ्रमण, वेपनानि, maranam va bhavati. Dear NA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.